Turning now to critical new global research surrounding pregnancies and COVID-19. A study published this week in the British Medical Journal indicates getting COVID at any time during pregnancy increases the risk of maternal death sevenfold. This compared to those expecting who remain COVID negative. Isabel Garcia spoke with the lead author of the study along with local maternal health experts. She joins us now in the studio with more details. Isabel, what have you learned here?
Yes, Adam, the study revealed more than just the increased risk of death for mothers who are COVID positive, but there's also a wide range of other serious health risks, too. Contracting COVID-19 during pregnancy severely increases the risk of maternal morbidity. The lead author of the study behind the new data is Dr. Emily Smith from the George Washington Milken Institute School of Public Health. Dr. Smith's team screened 137 studies, including 12 studies from 12 countries involving more than 13,000 pregnant women. And the results?
Women who had COVID in pregnancy had a 7 times higher risk of maternal mortality. They were more likely to end up in the ICU, more likely to need mechanical ventilation. And then we also found that they were more likely to have diagnoses like having pneumonia, preeclampsia, or blood clots.
I think it's very clear that these data mean that we as practitioners in OBGYN need to continue to advocate for vaccination among our patients, among the people that they're going to be around, and also to continue to advocate for the things that we know decrease the risk of getting COVID.
The study also shows infants born to infected pregnant women were more likely to be admitted to the NICU and to be born premature. Additionally, in contrast to other reviews, there was no link found between COVID infection during pregnancy and increased risk of stillbirth at or beyond 28 weeks along. Dr. Smith tells me she believes this is because the study included women who had COVID at any point during pregnancy.
I think the risk for stillbirth probably comes for very severe disease and later in pregnancy.
And of course, we're all familiar with those tasks to mitigate exposure. If you are pregnant or plan to be, you can check with your doctor to make sure you're up to date on your vaccines, including the booster, which is a single shot, and other safe practices such as thoroughly washing your hands, wearing masks, and social distancing when possible. Adam?
All right. Isabel, thank you. As far as the impact this study may have on future research practices or policy, the publication describes the need for a global effort to improve access to safe preventative measures as an urgent priority.